So we're going to talk a bit about back pain, Tal.
Mm-hmm.
Okay. So I think we're seeing a lot more back pain recently.
Yeah.
I don't know if you agree with that.
Yeah, we see lots and lots of people with back pain, actually, because I'm not sure if it's any more than before, but it certainly is a much bigger part of general practice workload than you might think.
When we say before and after, we're talking COVID.
Yeah.
Yeah. Fair enough.
Well, actually, in my case, I'm talking about before,
When you used to work.
Before cars were invented and stuff in the olden days.
Victorian times.
Yeah, that time.
Yeah.
But yeah, I think a third. We're really lucky. We get to have access to something called First Contact Physio, which is so physiotherapy service is often in hospitals, but what they're moving into the community, and so the physiotherapist comes to the surgery and does a clinic, and helps patients with our patients with back pain.
It kind of frees up your clinic time and
yeah, and actually I think they provide a better service as well. They talk you through the exercises. They are experts in that area.
They're very thorough. Yeah.
We got really good feedback from patients.
Tons of that. And they can also refer on for X-rays and other scans. They can also refer on to orthopedics, for example, if they can't deal with that issue.
A lot of times, actually, just to let patients know. I mean, you often don't need X-rays and MRIs and stuff, but if you do need one, then they're the people that will be able to kind of advise that.
One of the big things actually we get is that GPs can no longer request MRIs. So
yeah, I can't remember how long ago
it's been a while,
we could.
A few years.
I'm just trying to think back to when we could arrange an MRI scan, but certainly, currently we can't.
We can't.
And I think there are two reasons for that. One is because there are really quite strict criteria as to why you need to have an MRI, and the second is the interpretation of those results as well can be. It's kind of better for that to be done under a specialist. So if most back pain doesn't need an MRI scan. I know we've got patients from other countries where there's a lower threshold and where people do have MRI scans and stuff, but often it's based on the history and what you find on examination.
Just going on from that, what are the most common causes that you think that we see for back pain?
I think it's it is about just physical activity, the strength of the back muscles, just lifting things in an awkward way. I'm quite guilty of this actually, because not having the right posture.
I think working from home, a lot of us work from home, and we kind of feel the effects of that as well.
Well, I've found myself slowly over the years turning into a C, hunched over. Yes. So I've got to work on my posture. It does hurt over time.
Yeah.
And it kind of happens without you realising it as well. So you kind of doesn't
slowly builds up.
Yeah, and then even when you're walking, you got to walk with your back straight, lifting, with your back straight.
Yeah.
So we often see patients who, say if they're moving house or something, or they're doing some shopping or something. Actually, a member of staff at the surgery helped a friend with a suitcase up some stairs, and at the tube station, it wasn't particularly heavy and had wheels and stuff, but she had a musculoskeletal injury. So it can happen. It can happen actually. Sometimes it happens whilst you're asleep and stuff. Sometimes you just wake up with dreadful back pain and stuff.
Sometimes we see a lot of neck pain as well, isn't it? If someone slept awkwardly and then they have neck pain the next day.
Yeah, it's kind of quite often you think, what do I do? And you panic, and it's really painful sometimes because the back goes into spasm.
Yeah.
And you think, look, where shall I go? What shall I do? Shall I go to doctor? Shall I go to A&E? Shall I go to the pharmacy? Quite often the pharmacist is probably the first place to go. There's some really handy advice sheets that we normally give out for people with back pain.
Yeah.
It's really common, and there's tons of really good advice out there.
I think on the NHS Choice's website, there's some cases where rarely it can be like a sign of cancer.
Yes.
But that's like in very, very rare cases, isn't it?
I think if you've got other signs, like for example, if you've got weight loss, or it can be infections, it can be quite lots of other things that can cause it. But normally with musculoskeletal back pain, it happens quite suddenly. Normally, you kind of got a rough idea as to why that might have happened. Like for example, sometimes like people start going to the gym.
Yes.
And they're not really. They go straight into where like for me, for example, I haven't really been to the gym much for quite a while. I've been meaning to, but I might go today.
It's got in the way.
Yeah. But now that I see myself on the screen, I think I need to get myself back into that gym. But the thing is that
filter it.
the first thing I'm going to do is go back to the gym and then like think about doing exercises I used to like 5 or 10 years ago, and then I'm going to get back pain off the back of that.
Idea.
Yeah. So actually, you got to just ease into it because it can put you out of action for quite a while.
Sometimes it's stuff like slip discs and things like sciatica, and those are like more chronic conditions, I guess. Yeah.
Acute is things that happen like relatively recently, and chronic means like it's been there for a long time. For things like cancer and stuff, then it becomes much more. It's usually combined with many other things like weight loss or some other symptoms that might be.
It's not just that by itself. Yeah. And also, like, if you're not getting better after a couple of weeks, you should go and probably see someone.
Definitely. Yeah.
In terms of like how you can kind of combat back pain, there's a couple of things. So like staying active.
Yeah.
Like you said, going to the gym, but not like
gradually.
Yeah, like building up to that, not exerting yourself beyond like what you can handle.
Yeah.
Anything else you can think of?
Yeah, I think it's just
carrying on day-to-day stuff.
Little and often, isn't it? So it's just, funnily enough, it's not like those big, dramatic, heavy lifting, 120 kilograms deadlift. It's about just going for a walk. It's about having the right posture. Yes. It's about, like you said, working from home, just having the right kind of, the posture for you so that you're comfortable and stuff, and making sure the keyboard and all that stuff is right. Your
like chair, what you're sitting on, your desk, all of that makes a difference.
Having regular breaks, but yeah, I think all of that is fine. But then, basically, if you need help, then like contact your GP practice. Quite often, actually, lots of GP practices now have First Contact Physiotherapy. They might have a different name for it. You may need to go to a neighbouring practice to access that service, but it tends to be kind of shorter appointments, maybe. And actually, from a work experience perspective, we did some. I think it'd be really good for people who are interested in understanding what the other roles are in general practice. Then thinking, yeah, fine, the GP has a role, but actually they work with other healthcare professions such as the physiotherapist.
Yes.
And we've got some videos about a day in the life of a physiotherapist, and also some exercises and stuff they can do. And they in turn work with the consultants. So we do work with our colleagues in hospitals, and so I think it's we're going to try later on to get those people involved and give people a little flavour of what it's like to work in the hospital. But it's about the NHS is working with teams of other people, and none of it could happen without the admin staff, the nursing staff, for example. There's a whole bunch of stuff that we all collaborate, and it's not like one specific role. Yeah.